This is part 7 of controversial opinions I have as an endometriosis dietitian working in this space. And in this video, I'm talking about how it is never okay and not concerning if you have flagged or abnormal results. I cannot even tell you how many people I connect with in the endometriosis space who have flagged or abnormal results that have some pretty significant implications for their body with endometriosis. Now, I want to give you a couple of examples. One of the most common labs I see in endometriosis patients that's elevated or flagged or abnormal is thyroid antibodies. This could be thyroid peroxidase or thyroglobulin antibodies. Well, there is definitely a upper threshold or cutoff in Western medicine. Really, any number here can be a bit of a signal for you that you need to start paying attention to your thyroid function, especially as somebody with endometriosis, because we know that autoimmunity is more likely, and that just complicates living with endometriosis that much more. Another example, which I've talked about in a few other posts, is some of those funky sounding immune cells on a complete blood count with differential. Even if you have slightly elevated basophils, this can be communicating to you that you have an issue with histamine buildup in the body. And because histamine buildup in the body can contribute to inflammation body-wide, this is definitely something to pay attention to. Another example from this panel is the eosinophils, which when elevate is typically an indication of some kind of food or environmental allergen. Because endo is a condition of immune dysfunction, and these are allergens we're talking about, when you're allergic to something and you're exposed to it, your immune system will mount a pretty sophisticated response to that, and that will generate a bit of inflammation, compounding on top of the inflammation of you having endometriosis. A few other examples would be things like a very low DHA sulfate or testosterone. These are hormones that will increase pain sensitivity and can affect implantation in somebody with endo who's trying to conceive. Suboptimal progesterone levels are another one I see so often, and because progesterone is your anti-inflammatory, anti-growth promoting hormone, we really want to be supporting healthy levels in the luteal phase, which is after ovulation. I have an endometriosis specific lab guide that I've developed to help you better understand what might be going on in your labs, how to tease it apart, how to understand it better, and then how to apply interventions that are specific to you, specific to your blood work, so you can access that lab guide at the link in my bio.